always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get to question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all the resources that I do offer. And as always, I like to direct you to my business profile by simply going to Google and searching the Nursing Studio. It will bring you here where you can find my contact telephone number, link to my website, and testimonials from previous review students. All right, question number one. A 36-year-old patient presents with nasal congestion, facial pressure, purulent nasal discharge, and maxillary tooth pain lasting 12 days. What is the most likely diagnosis? Is it A, viral rhinitis, B, allergic rhinitis, C, acute bacterial sinusitis, or D, community-acquired pneumonia? Take a moment and tell me what you got, y'all. All right, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the most likely diagnosis? And when they're looking for a diagnosis in the stem of the question, I always say run it back and look at the assessment findings because you got to determine what it is from that standpoint. Looking at how they present, what are their signs and symptoms. So we have a 36-year-old patient, comes in with nasal congestion, facial pressure, purulent nasal discharge, maxillary tooth pain, and all of this is lasting 12 days. This is your key that this is acute bacterial sinusitis. Bacterial sinusitis is typically deemed bacterial by guidelines if these symptoms are from 10 days or greater. So that 12 days is a key point for you. All right, question number two. A 58-year-old man with hypertension and CKD is starting pharmacologic therapy. Which medication is most appropriate? Is it A, hydrochlorothiazide, B, amlodipine, C, lisinopril, or D, metoprolol? Take a moment and tell me what you got. All right, so stem of the question states, which medication is most appropriate? So again, this is a treatment question. So as I always tell you, if they're looking for a treatment, look to see if they provided you with a diagnosis. And so here we are treating hypertension. They're starting pharmacologic therapy. Patient has a history of CKD, so that lets you know that we need renal protection, right? So your best answer will be C, lisinopril. Remember that anytime we are managing hypertension and the patient warrants renal protection, like they're diabetics, they have chronic kidney disease, or if they mention any protein in the urea or albumin in the urine, then we want to make sure we're given an ACE or an ARB. ACE inhibitors ending in pril, ARBs ending in sartan. So here your best answer is lisinopril. And then lastly, question number three, a 28-year-old woman presents with thin gray vaginal discharge and a fishy odor. Clue cells are seen on microscopy. What is the recommended treatment? Is it A, fluconazole 150 milligrams single dose? Is it B, metronidazole 500 milligrams orally twice daily for 7 days? Is it C, clindamycin 300 milligrams orally twice daily for 10 days? Or is it D, azithromycin 1 gram orally for a single dose? Take a moment and tell me what you got. All right, and stem of the question, what is the recommended treatment? So again, if they're looking for a treatment, run it back and see if they provided you with a diagnosis. If they have not, like in this scenario, they didn't provide the diagnosis, that means we got to run it back a step further, look at those assessment findings so that we can determine what it is, because we got to know what it is to be able to treat it. So this patient comes in with thin gray vaginal discharge and a fishy odor. This is classic For BV, bacterial vaginosis, clue cells are also seen. So first line therapy for BV is metronidazole, also known as Flagyl. So first line therapy would be 500 milligrams of your metronidazole. Make sure you are familiar with both generic as well as brand name, because if they present it to you in a fashion like this where it's metronidazole, make sure you're not missing it just simply because it does not show the standard name of Flagyl. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But as always, if you need any of the resources that I offer, feel free to reach out to the nursing studio. You can give us a call, shoot us a text message, or an email. And everything that I offer is linked in the bio of this channel, including my website. And as I previously mentioned, my website is also linked in the description of this video. And as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.